creation of the College of Health Science and Technology and the creation of a new task force to look at healthcare careers for deaf and hard of hearing students came along in parallel. They both were kind of launched around the same time, so the timing was perfect. And this task force brought together people from U of R, from RIT, NTID, Gallaudet University, to investigate what the hurdles were, because clearly there were lots and lots of jobs on the horizon for any of the students interested in careers in healthcare. So why not deaf and hard of hearing students?
The number one challenge for most deaf and hard of hearing high school students is really that they don't believe that it's possible for them to get into healthcare fields. They do have options available to them. We have a variety of both technological and accommodation services. If someone's unaware of what's available to them, then they may not believe that it's at all possible to attain these kinds of careers.
Research has shown that when scientific teams include people from differing backgrounds, the research itself tends to be more robust, with more novel discoveries being made. By introducing deaf people to the team, they can provide a fresh perspective that may help the other researchers view things in a way they hadn't thought of previously. This can have a big impact overall. The Rochester Bridges to the Doctorate program is unique in that it supports deaf and hard of hearing master's level students here at RIT who want to continue on for a doctorate program. We provide a lot of support and mentoring.
My goal of becoming a medical doctor is unique and non-traditional in how I decided what to pursue. I used to work for the Deaf Studies Lab, where I received a lot of support. We discussed my thoughts of becoming a psychiatrist, which I decided against. My coworkers supported me and offered suggestions as I went along. I always knew there would be challenges to face. Some of my hearing colleagues, fortunately I was lucky and not many were this way, but some people doubted that as a deaf person I was capable and they were resistant to me. I have found it is important to be open and communicate with others. I can share that I do use an interpreter. I use a cochlear implant. I need to be able to see the speaker's lips as well as the interpreter. I want to make people aware of what I need and let them know the interpreter is there for them also to facilitate conversation between us all. One resident did approach me after a few days of working together to admit that in the beginning they were expecting a really rough week with me. But they found it to be much easier than anticipated, which was a relief to both of us. I'm glad they shared that with me, and it reinforces that my system of open communication works and is vital for success.
We think it's important here at RIT, where we strive to reach diversity and a community of tolerance of all people, to do the same with respect to our training programs, so that these people will go out into the workforce and help to spread that subpopulation into the healthcare workforce. It's really about creating a healthcare workforce that mirrors our population, our diverse population.